सर कोई चेयर बहुत जबरदस्त सेशन है करते हैं सर आप थोड़ा सा ना वो आज भी बहुत जबरदस्त
ठीक है ठीक है
तेरा शुक्रिया तेरा शुक्रिया मुझे तुमने बहुत कुछ दिया तेरा शुक्रिया तेरा शुक्रिया ना मिलती अगर होगी रात तेरी तो क्या थी ज़माने में औकात मेरी तुमने तो जीने की काबिल किया तेरा शुक्रिया तेरा शुक्रिया मुझे तुमने दाता बहुत कुछ दिया मुझे सहारा तेरी बंदगी का है जिस पर गुजारा मेरी जिंदगी का मिला मुझे कुछ तुम्हीं से मिला तेरा शुक्रिया तेरा शुक्रिया मुझे खुद दाता बहुत कुछ दिया किया कुछ ना है शर्मसार हूँ मैं तेरी रहमतों का कर्मदार हूँ दिया कुछ नहीं बस दिया है तेरा शुक्रिया तेरा शुक्रिया मुझे तुमने दाता बहुत कुछ दिया मेरा मुझको जो कुछ बना तुम्हारी मेरा कुछ नहीं सब है दौलत तुम्हारी उसे क्या करूं जो तेरा हो लिया तेरा शुक्रिया तेरा शुक्रिया मुझे तुमने दाता बहुत कुछ दिया मेरा ही नहीं तू सभी का है दाता तू ही सबको देता तू ही है खिलाता तेरा ही दिया मैंने खाया पिया तेरा शुक्रिया तेरा शुक्रिया मुझे तुमने दाता बहुत कुछ दिया तेरा शुक्रिया तेरा शुक्रिया मुझे
Can I start? Yeah. Yeah. So, can you increase the volume? Yeah. थोड़ा सा volume को increase कर दीजिए.
हेलो
Yeah. So, good morning, everyone. Can you hear me? Yeah. So, I thank sir for giving. Yeah. I just like to thank you for giving me the opportunity to interact with you. I came for another program, for your institute, a GCP program, Good Clinical Practice. and today we are going to discuss good clinical laboratory practice. So today morning, I just wanted to tell you chronology of innovation across the world. You know, how people think, because during the undergraduate, you have a fertile brain. You can think of new idea, how you should think of a new idea and it can be implemented. Okay, so if you look back, long time back, people used to work on prostaglandin. And based on prostaglandin, we have many drugs, all the NSAIDs, non-steroidal anti-inflammatory drug. Later, people started working on nitric oxide. Okay, and if you look at the nitric oxide, we developed nitrosoaspirin, and there are other drugs. People got also Nobel Prize. Then people work on endothelin. So if you look at that, one of the conditions, pulmonary hypertension, it's very difficult to treat. And because the endothelin, there is an endothelin antagonist, bosentan, has been developed for pulmonary hypertension. Otherwise, it is not curable. Then people work on stem cell therapy, still it is there, nanotechnology, and today we discuss about artificial intelligence and machine learning. All forums when you go, they will talk about that how to use the artificial intelligence and machine learning. So these are pattern of medical one when you look at that. But if you look at that, 70% of Nobel Prize is received from animal studies. You can take an example, diphtheria antitoxin. It is done in guinea pig. Okay? Then, Benting, insulin, all these discoveries, 75%, it's on animal experimentation. Now, here if you look at the COVID, you have seen COVID. One of my students said, in life we have seen COVID, also Operation Sindoor. Okay? COVID, what we learn? We learn how to go for an isolation. But before COVID, because all this pandemic, epidemic, it comes in 100 years. Before that, there is a Spanish flu. And if you study the Spanish flu, they also were isolated first wave. And the second wave, they got bored, they came on the road, they were hugging. And 50% of the population, they died. Okay, 50% of the population, they died. And this time also, it was a first wave, we were very disciplined. Second wave, there are a lot of mortality. And all this experiment we have done, in animal experiment, in a COVID, how to select. We have done the vaccine within 8 months. I am chairman for a vaccine for India from the ICMR. We did it in 8 months. Otherwise, to develop a vaccine, and it takes around 12 years, 20 years. Okay? So this is how we look at. So if you look at Newton, I was there in Cambridge, UK, and I was there in Clare College. And Newton, he actually was a chairman in Trinity College. It was Newton, he had a very disturbed childhood because his father died, mother got married to another man, and she put him for farming. Only his maternal uncle, he put him in a school. Whole life he has only 3 PhD students. In his class nobody come. It was for 1 hour. Then it is reduced to 30 minutes because he speak to the wall. So people do not come. But he had all the discovery, Newton, So this is how he contributed. So if you look at the Egypt civilization, so there is one person called Imhotep. What he said is he had identified all this new medicine. Even in AIMS, when I was doing an MD, I had taken from Egyptian civilization castor oil in osteoarthritis because castor oil has a naricin. So we did a clinical trial in osteoarthritis. So if you look at the 200 disease perform, extract the medicine from plant, new position, function of vital organ and circulatory system. That time only he described from the Egypt. Look at this man. You know how tea is discovered. Tea you have today, how it is discovered. There's a king in China, and he is a crazy man. He goes to anywhere in the jungle, and he has a habit of taking boiled water, warm. In the jungle, he put some leaves into the boiled water. He was drinking, and that's how discovery of tea had come. If you look at this man, you know, he is an emperor. He has a habit of consuming all the plant. And how many plants he has consumed? 365 plants. He wanted to see that how much poison you can have. And later he turned into green and he died. Okay? So then you look at that other one, discovery for artemisinin. That lady from China, she discovered artemisinin compound. You have chloroquine, you know, other drug, but this is for the malaria, resistant malaria. So this is how she got a Nobel Prize, and she had written a handbook of prescription for emergencies also. Now, if you look at the Egypt, one of the two oldest preserved medical document, most voluminous, 110 page and a 700 magical formula. This is from Egypt civilization. So if you look at that hour, because nobody taught us that how rich we are, Indian. Even the Hippocrates had copied from Sushruta. Sushruta said, you know, a lot of medical devices, instruments were devised. A lot of, you know, optal surgery has been devised. So during that time, he counted 300 bones, advocate cleanness of the wound procedure, which was taken by, you know, Hippocrates, and discussed the option of instrument for breast instrument. So this is what Hippocrates copied Sushruta concept for wound healing. But he has given a clinical indication how do you diagnose a pulmonary edema. So if you today say we look for a clubbing, if there is a pulmonary edema, you can see the swelling of the fingers, and you have a concept that we put the stethoscope. He said you put your ear and we can hear the crepitation. So this is what Hippocrates, and he had the concept, if the water is used for irrigation, had to be pure, boiled, hand, nail, operator will be clean. So this is the concept Hippocrates disclosed the dissociate medicine of theology, philosophy, established science and medicine, and provide the physician highest moral inspiration. So these are concepts were there from Hippocrates. And today, when you become a doctor, what do you say? You take a Hippocratic oath, do not do any harm, and do not do any harm intentionally. If you look at Iranian civilization, so there is a scientist called Al-Razi. He had actually discovered alcohol as a today. Then contribution to medicine, you know, all this philosophy, that 184 books and articles. Now another very famous person, Ibn Sina, probably he was born in Uzbekistan. And today if you say, if I ask you a question, as a medical student, how do you check the quality of medicine? Okay? How do you check the quality of medicine? And common man also buy a medicine, they ask for the expiry of the medicine. Is it expired? Where is the expiry date? You look at the license number, you look at the batch number. During that time, he said, born in Uzbekistan, leader of pharmacy, philosophy, medicine, pharmacology, and wrote many of the books which is quoted in European medical textbook, and he knows theaters a clinical trial provided. And look at this, his concept. He said drug must be pure. You said today we talk about quality of the medicine. We said how is the quality? You call it NSQ, not of standard quality, spurious, counterfeit. Okay, so he put 7 conditions that must be tested in one condition. Lot of product they claim for multiple indication. He said it should be claimed for only one indication. Then drug must be treated contradictory to disease state, strength of the must be proportionate to severity of disease, time of therapeutic effect, drug must be observed in continued action, drug must be tested in human before judgment. All 7 conditions, if you say this drug is working, but look at his concept long time back, it must be pure. He talked about quality, all 7 conditions. Then look at the microscope. Some of you are wearing the spec. How it came? It was first AD class invented by Romans, recognizes when trick of middle thin edge magnification, then focusing the device, and later the glass was device and the microscope, and we have new technology for all the microscope, confocal microscope. It was described. So in case of hematology also, if you look at that, defined circulatory system by William associated with rare disease, and then Christopher said that first IV needle, it was described. Any ward you go, they say what is the biggest needle we use in our practice? It's a blood donation. When you donate the blood, it's the biggest needle. What is the size of the needle? 18 gauge. And if you go to the ward and say what is the smallest needle, it's 26 gauge. What does it mean? 18 gauge means it's a bigger one, 26 means smaller one. Concept is that if you take a 1 inch, cut into 18 pieces, and out of 18, this is a 1 part, it is 18 gauge. 1 inch you cut into 26 pieces, that small piece is smallest one. Now clear? 1 inch you cut into 18 pieces, that will be the biggest we use for blood donation. And the smallest is 26 gauge, and that's how we describe, all this Christopher. But if you look at that clinical trial, on 28th of May, what we celebrate? Clinical trial day. And all this concept people see 500 BC, it was started the clinical trial. So there is a king, and in the king, palace, there is a fight between 2 groups, whether vegetarian food is better or non-vegetarian food is better. Then king decided, let's take one group vegetarian food and another group meat with wine. And after 15 days, they make an evaluation, and vegetarian food was much better and compared to the non-vegetarian food. Okay, so cheers to vegetarian. I think hardly there will be 1 or 2 people here, So that was. Now, if you look at that, during the COVID, we learned a lot of technique. Decentralized clinical trial. Why decentralized clinical trial? Because patients were not able to come to the hospital because of lockdown. So the investigators were going to their house. Adaptive design. There are so many new techniques we started. So this is a king where they had a fight, and he assigned 2 groups, vegetarian and non-vegetarian food, and ultimately they found vegetarian food is much better compared to non-vegetarian food. Okay, and then if we look at the clinical trial, what we say that 28th of May we celebrate clinical trial day. Why? Because of scurvy trial. When they go into the sick, they have a scurvy because of deficiency of vitamin C. And first clinical trial was done with ascorbic acid. So if you look at the James Lin, 1700, he did a trial. He has put into the vinegar diluted sulfuric acid, cedar, seawater, and ultimately he compared statistically Which one is better? And finally, it was found that we need a supplementation with vitamin C in scurvy. So this was, now coming to smallpox, you read the smallpox, how they develop a concept of vaccine. How they do it? Those who suffer from smallpox, they said, give us your cloth, and they'll weigh the cloth. And they have pastille, put it into the nostril, so that you develop an immunity. So here, some of the story, 11th century protective measures, smallpox included putting the scraped smallpox pastille into the nostril. It was putting in the nostril so that it will absorb and it will develop immunity. Then, second thing is, wearing the cloth someone who had already had a disease or ingesting powdered feed infected cows may perceive relationship of cow to smallpox. So this is how the concept done. So if we look at COVID time, first day when we had a meeting on 22nd March, we thought we will not allow AC inhibitor to be used. But later we found that AC inhibitor is absolutely fine. We thought steroid cannot be used because it is immunosuppressant. Later we used steroid because of cytokine. So concept with the data is also changed. If you look at ventilation protection, Africa, China, India, and London, smallpox hospital in 1745. So this is a man, Benjamin Jesty. He was in a village. He inoculated his family, wife and children. And that's how if you say 1805, publicly inoculated robot with smallpox, we demonstrate that it is still protected. But the concept is, today you go for any vaccination. Like earlier, you say hepatitis B vaccination. We said it will give a lifelong protection. But today you know that maybe 8 to 10 years. Okay? So things are changing. Even COVID also, first wave, second wave, what we learned, you go for first vaccination, second one, then you also look at, another dose. So this is how cowpox vaccination was there, consists of smallpox and then eradication of smallpox. So the last case, it was somewhere in Somalia. Last case. So from world, all the smallpox is eradicated. Okay, I think there is a news that there is also a smallpox case from Bangladesh. Okay, otherwise we don't have a smallpox. So if you look at people like me, there's a big, that is we have taken for a smallpox during that time. Otherwise you don't need. Now, small idea. You wash the hand, you have a cleaning. If you look at this concept, Sushruta advocates sterilization of wound, and Hippocrates advocate that he used the boiled water. Okay, so this was a Hippocrates promoted clean hand with the wound management. This is the man. He did a lot of work. Then he lost the job also, because his boss was not accepted his data. So he was an ops guy, and he's in Vienna, 1848, 1863. Death of the brain infection of autopsy related to wound primary hypothesis infection was transported from autopsy uninfected patient. There are a lot of disease might come, it can be transported. So what he did is, he had said that wash your hand with chlorinated water. And he demonstrated that infection 18%, it reduced to 1.3%. As I said that his boss did not accept his data and he lost the job. He was terminated. Then again he came back. This is a paper he had written. How much is reduced when you wash your hand with the chlorinated water? Then he designed an instrument also. Today you say you go for the autoclave. Okay, sterilization. All this you go for. So that concept was there in 1800, and then he wrote this paper that how much it reduce when you practice or implement this SOP. So then, coming to epidemiology. You know that people who worked during the COVID, I was a task force member who were there. All the people working COVID, they are epidemiologists. And they are working for HIV when in the HIV came. You know, some concept that if you go earlier, primary health center, they used to boil the needle and they reuse. Needle injection is to boil and they reuse. How the concept changed? Disposable needle, only it came during the HIV infection. That you have to discard. You burn the needle, cut the needle, put it in biomedical waste. This was not there earlier. This came when the HIV came. Okay? So this is what epidemiology, if you look at British physician, anesthesiologist, he had, you know, so epidemiology is very important. You do a studies, and when you do a studies, if you say, how about rural area? How about semi-urban area? How about urban area? If you say, you know, can you go for a prevalence and incidence of a particular disease? You cannot go to door. Okay? You can select an area that will reflect the whole population. Rural area, semi-urban, or urban area. So this is a technique it is used, the spot map, and industry begin. If you look at the pancreas digestion, glycogenation, it is by Claude Barnard, born in a village Saint in France. Then leukemia was diagnosed. And who did it? You know, Ludwig Virchow. He diagnosed the leukemia, and now pulmonary emboli, thrombosis and emboli. So how do you say? When blood get clot, we call it clotting. Once clot goes to the circulation, you call it emboli. And when it blocks, either you have a stroke or you get a consequence. So the terminology changed with the clot embolism. Pasteur, he had, you know, germ theory, discovered Staphylococcus aureus and vaccine for anthrax and vaccine for rabies. Today, you see any rabies case. Have you seen any rabies case? Once it develops rabies, nobody can save him. Nobody can save him. You cannot keep him in the fan, you know, aerophobia, hydrophobia, typical symptoms of rabies. So only preventive action is you have to give the vaccine. There is no curative therapy. Then Boring, he discovered antibodies, diphtheria antitoxin. First used passive immunization. 1900, he was awarded Nobel Prize for the diphtheria. Then Paul Ehrlich, what he did is he had described eosinophil. You say eosinophilia. One of the indication is parasitic infection or any allergy. Okay, he described the first eosinophil and shared Nobel Prize with, you know, another person in 1900. Then he also worked on syphilis, and he coined first time magic bullet. Magic bullet, that antibiotic. And after 100 years, there is a meeting in Germany. I was also invited. Today you say that how many new antibiotic has come in India? One antibiotic is nephritomycin. Very few, but people are working on antibiotic peptide. So this is how insulin was discovered. They got a Nobel Prize in 1922 and 23 Nobel Prize Benting and MacLeod. And then Alexander Fleming, you know, you read the discovery. How Alexander Fleming discovered penicillin. Okay? And that's a landmark during 1942 that he discovered penicillin, and Nobel Prize in 1945. Then polio stories, if you look at that, they got a prize, you know, in South American researcher, a virologist successfully inactivated polio vaccine, 1.1 million, you know, they are associated manufacturing. Then all this, you know, 7 vaccine, you know, oral polio and other polio has been there. Who is the lady doctors in India? first lady doctors in India. She is Dr. Ganguly. I have a picture to show you. So when you say women in research, and you can remember Nightingale, only concept was promoting cleanness during that war because people are dying because of sepsis. And she promoted, all these cleaning sanitary conditions for a soldier. And this is what the Florence Nightingale, then Marie Curie. This is the lady who got 2 times Nobel Prize. 2 times Nobel Prize. And she had developed a radioactivity. And then it was implemented in French army how to take the X-ray. And later her daughter, and also husband, they have a Nobel Prize. So if you look at the radioimmunoassay by yellow, then Janet Davison, chromosomal translocation of leukemia. These are the discovery. We know leukemia, ALL. Okay, we have a therapy now also for CAR T-cell therapy, So she discovered the chromosomal translocation of nuclear, translocation of Philadelphia chromosome with certain leukemia. Now, how the concept becomes blinding study. When you do clinical trial, you call it randomized control trial, RCTs, gold standard. Most of this technique we learn from the PEDI field, so that it will not have a bias. Okay, so all the placebo use blinding, frankly, they use that prolonged placebo effect. So today, if you say, how do you justify placebo in clinical trial? We justify it because World Medical Association says that if you have marginal efficacy, you can use the placebo. But only thing that when you use placebo, that means it should be prepared in GMP condition. Any drug, any product, you give it to the human, it has to be prepared in good manufacturing practice. Then only it is allowed. So this is what blinding statistic is come. So you say that we always discuss statistical significance and clinical significance. You know that we calculate the sample size before you go for any studies. How do you get to know statistical significance and clinical significance? All of us, we watch cricket. Okay? He's a hard hitter. He come, every ball he try to make 6. So if you calculate his strike rate, it will be around 800 strike rate. Then if you take Sachin Tendulkar, he try to stay for a whole day. But if you take a strike rate, maybe 80%. So when you get to know 800 strike rate, but he stay for a short period of time. And that is why you have to put your mind how statistically and clinically it is significant. And this is how medical council led by Austin, he used first streptomycin in clinical trial. Randomization. All these techniques have been implemented in London. So ultimately, when you do clinical trial, all the ethical, scientific, all the principle, and we have a regulation called Drug and Cosmetic Act, and we have an ICMR guideline, and we have a Indian GCP, all this have been, taken. So if you look at the ethics, we are very rich in ethics. We take a Hippocratic oath. Our regulation is very strong on the ethics. So this is how chronology, Nuremberg Code. You can read the story Nuremberg Code. So during that time, they were doing a lot of clinical trial, and it was a very good science. Many drugs have been developed. But today, any say good science is a good ethics. Then we have a Belham report. Is it going to give benefit? Is there any risks involved? Can you justify doing a study? So this is how we talk about Hansen, who discovered leprosy. But he did an unethical practice that he had given leprosy bacilli to a nurses forcefully, without the consent. later inoculated leprosy bacilli into nurses patient without the consent, and court took a legal action to remove Hansen from the research. So today, if you say anybody you approach, you are going to take a consent. You are going to take a written consent. Okay, then only you are going to recruit. So this is how informed consent, yellow fever, it was started. Anyone wanted to use or recruit in the research, you are going to tell all the possible benefit, risks, and then only say, do you like to participate? And this is how consent did come, and this is how Nuremberg Court, it says, when international court was there, they said, for justification. In war, few must die to save many more. Anyway, Hitler is going to kill them. Third one, they said, we are from army doctors. So whatever order passed, you cannot say no. Fourth justification they put, anyway, it's not only in Germany. US also do a lot of malpractice, unethical practice. But this is not accepted in international court. Then a concept is coming is individual autonomy. What is individual autonomy? If the patient comes, you say, can I ask you this question? Can I examine you? It is something like with respect. So any, research you do, there should be social value. What is the positive impact is going to happen, So this is how you do. So all this reckless, it is there. So ultimately the concept is don't do any harm. Don't do any harm intentionally. Okay? So this is what we need to do. As a doctor, as a pharmacist, as a nurses, we have taken a Hippocratic oath, do not do any harm. Okay? We only work for a benefit. So this is how we took an informed consent, enhanced clinical trial, So today you say anything you do, how about male? How about female? How about transgender? Okay, one of the lady in Glasgow, one of the meeting, she asked me, Bikash, do you have a guideline for male-female orders? I posed it. Then I said, we don't have a guideline. So today, anything you do, how it is going to get benefit for male, female, and others. Even preclinical studies also, you say male and female. So we publish some of the paper, and this is the era is going on, it's artificial intelligence. But I just request you, you should put your mind. Don't go away with artificial intelligence. I'll give an example. I used to go with US FDA inspector for an inspection. I was in Hyderabad and we had to go to a place called Genome Valley. So US inspector said it is going to take 2.5 hours from Hyderabad to Genome Valley. He looked at the app. Then I said we'll reach by 1 hour 45 minutes. And we exactly reached 1 hour 45 minutes. He came to me, how did you know we are going to reach 1 hour 45 minutes? Because app was saying 2.5 hours. Then I told him that this driver, I've been roaming with this driver for last 3 days. So I know how he drives. So you use artificial intelligence once you require a large database. You should know the technique, but use your own intelligence. Today you write a paper, there are a lot of software, grammatical software, EndNote. Why don't you do it manually? Learn it. Do it manually, learn it. Then if there is a large database, you are going to do it. So this is the guideline has been released from ICMR on artificial intelligence and machine learning. So these are all ethical aspects. When you take a data of any patient, you are going to take a consent. If you collect some biological material, urine, blood sample, you wanted to do for other project, you have to track down the patient, you have to take a consent. If it is not there, you are going to go to ethics committee and get an approval that I'm not going to disclose any identity. Okay, so this is how all ethical principles. So India had conducted, summit of artificial intelligence, all the ethical principle, So this is how you say, early detection and screening, any of the disease. If you detect early, it can be prevented. And that can be used by artificial intelligence, or you say all the clinical decision, can be. So now it is a technique. If you say somebody has apple-like urine color, AI will tell you that this is the early detection for chronic kidney disease. And these have been incorporated in a software. But what I'm trying to say that do not forget to use your own brain for clinical skill. Okay, this is very important, the clinical skill. And that's how, we have a meeting, you can see the people who came, for contributing artificial intelligence for India, because India has a large database. No country will have that large database. So this is how section danger we say that. But you know that we use a lot of artificial intelligence in drug discovery. You do an experimental study on Alzheimer's, and when you do clinical study, it failed. Can you use AI in experimental data? How much it will be feasible to use in clinical situations? Because when you select any of the drug, does it cross blood-brain barrier, blood enzymatic barrier? So this is how we do all the screening technique, high put through, ultra high put through, pseudo sort. So these are discovered, technique has been used. AI to reduce the time. What I say that we develop vaccine in 8 months. 8 months. Normally it takes 20 years, 12 years. But we did it in 8 months because we had a teamwork. We want a monkey. They went to the forest area to take out the monkey. Today we are working on Zika virus. What is the monkey we want? From African origin. But we don't have an African origin monkeys. So we use another monkey, is called marmoset. So this is how we do all the scope. AI has been used. But one thing is there. If you say, I wanted to use AI for breast cancer, AI will not give information about male breast cancer. That is a limitation that needed to highlight. Okay, so then industry is growing. How our industry is going? It is second largest. I'll give you two stories. 22nd March, we had a first meeting on COVID. We thought of going for an hydroxychloroquine. Dr. Paul is a chairman, Medhi. He asked me, should you go ahead? I said yes. Because if you look at pharmacokinetic and dynamic, it reaches lung tissue on 5th day. But we decided that if we recommend hydroxychloroquine, we have 140 crore population. Do you have enough hydroxychloroquine supply? If one person also developed COVID. But after 20 days, we export to 200 countries. So, President of Brazil said, thank you, Modi ji, with Lord Krishna. We export 201 million vaccine, including Pakistan, because we have the capacity to manufacture. So it is growing at 20%, So these are things need to be decided. Unless you put in R&D, you are not going to grow. There is a company called HMT, they used to manufacture watch. Today you don't get that watch, HMT watch. They only do the tractor because they didn't put money in R&D. So there's a musical instrument boss, all the money he earned, he put for R&D. So you can make a comparison how much India gives, how much other country give, Europe and, So you can look at this achievement. So that's how you say that how much you import, how much you export. Then we talk about Atmanirbhar, because we are saying that we are going to have a Viksit Bharat by 2047. Okay, so this is how industry is spending. Unless you spend in R&D, you're not going to grow. And that is the important point, that how much we give. So how much, when we had only generic market, today after 2005, people are looking for a new drug. Sun Pharma, all this leading pharmaceutical industry, they're looking for a new drug. And we have discovered, so these are innovation are decades, it is going to go and these are high level of innovator. So you need to think that, can I identify? I always tell the student, don't think we have medicine for all the diseases. We have many diseases we do not have a medicine, like celiac, autism. They can make a list of diseases. Nobody work on rare disease, orphan disease. Now you think that, can I contribute one thing? So this is how you look at pharma is growing, and we have a setback because of US tariff, but it will be overcome. But you say that, what we stand in innovation? Maybe 80 position, we have a long way to go. Even if we look at the publication, we only contribute 4%. So many medical colleges, universities, 1400 universities, 800 medical colleges. We contribute only 4%. Even if we look at the knowledge index, Singapore is number 1. In Europe, Switzerland is number 1. So that means we have to contribute, and this is what Global Innovation Index is, even how many medical colleges we have a patent sale. Do you understand what is innovation? How do you apply for a novelty certificate? You think something novel, So this is how you do. This is done by an undergraduate student. When you give chemotherapy, you're going to lose the hair. So this UG student made a devices for cooling of the hair. Cooling means there will be vasoconstrictor. Chemotherapy will not come to the hair follicle. And this paper is published in Archive of Internal Medicine. I did an exercise in Nepal. Nepal has 19 medical colleges. I put a selection committee, all 3 students from each college. They are exceptional. Again, for undergraduate, for nursing also, you can make a research council. You can do small research. You can collaborate with other rest of the country, but it is very important, novelty. So one of the example I'll give, one medical officer in Maharashtra. He was working on Scorpio bike. He sent the paper to ICMR journal, it was rejected. Then he sent it to Lancet. Lancet only said, can you allow us to improve English? He said yes. Same paper was published in Lancet. So this is what the novelty is important. Innovation of pharma, it is growing. So global example of collaborate. One of the editor had come to IIT Bombay, and one of the assistant professor had asked, why can't you publish in Lancet, New England Journal of Medicine? You don't have a collaboration. You do not collaborate with another department. You do not collaborate with other institutes, and that is what we go. So this is the first lady doctors from India, Dr. Ganguly, Kandamani Ganguly, and that is why you say that anything you do, it's a best practice. You go to the lab, you follow OECD, Organization of Economic Cooperation and Development. You come to the clinic, you follow GCP, ICGCP, Indian GCP, and this implement should be. So there is an academic clinical trial, it has been done. So I have proposed, and this is what Indian GCP, I happen to be chairman of Indian GCP. So, but anything you get an opportunity, in a village some plant product is used for particular condition. So that means you can extract the information. You can take the modernized way. We have an Ayush, Ayurveda, Unani, Siddha, Homeopathy. Now Tibetan system is also included. So this is how publication skill development we had done. But it is important to look at patient safety. To the patient come, are you safe in hospital? So if you go to Geneva, this is a fountain. And I used to have a cup of tea. And this fountain symbolizes patient safety. And we celebrated on 17th of September. Okay, so this is how patient safety we had come up with Indian guideline. I have prepared the guideline. So these are some of the pictures of patient safety. And right now I have taken over as a chairman of IUFAR for 4 years. I'm the first Indian to be appointed as chairman. It's in Paris. Okay, so we are going globally. We did some program in Malaysia, Indonesia. Before I came here, I was in Australia. So this is how we go. So when you create an environment, somebody created a history. Because all of us look at one direction, that person look at another direction. And he created a history. So this is how we have to create a research environment. Think outbreak and epidemic, and this is my website. So definitely, so we have to look the rural part. Don't think only metros, because 80% our population is the rural part. So you have to think that, can I do it for some rural area? So this is how we look at, and we have to work together. So this is how we say that if you look at this camel, it's a double hump camel. We're doing a project. You only get it in Nubra Valley in Leh, Ladakh, and Iran. So how is the behavior of this camel? If you go in front of them, they'll split at you. And we are trying to make them behave because they can carry up to 300 kg to top of the hill in 13 minutes. So if our neighbor comes, we can mobilize the troop with double hump camel. You got the point? We can immediately mobilize a troop in a hill area, and that is why you are doing a project. And she is blessed with another children. And this children was very sick, now it is fine, So this is what we do. We have some of the books. So thank you very much, and Jai Hind. So any question, I said, if you try to do any research project, I'll be the person to go for a mentorship, to help you, to write the protocol, to conduct the study. I may not be coming physically, but you can always contact me online. I'll be available. Okay? So I'll give it to sir. हाँ नहीं हाँ
सर ये ना जो रेगुलर बैच है वो पूरा फार्मेसी आता है, नर्सिंग के लिए बैच को आता है।
हाँ जी
सर बहुत सारे अच्छे बच्चे हैं, अच्छे लोग क्वेश्चन है, कोई भी जल्दी से को जाना है, ये माइक्रो कोई भी नर्सिंग में मेडिकल में जो भी मन में सवाल है, और वो जल्दी मालूम हो उसको करवा के बहुत अच्छे से है, ये जल्दी करो, आप तो पहले क्या जल्दी करो नर्सिंग के लिए मेडिकल
Any questions you have?
चलो लोग किसी के मन में कोई सवाल हो, कोई फार्मेसी लेकर भी कुछ भी पूछ लो, तो पूरा एंसाइक्लोपीडिया है कि क्या होगा, जैसे कि पकड़ो अभी पूछ लो तो कभी नहीं मिलेगा ये मौका, अरे मतलब बात तो देख लो है, कोई एनीवन आप एनीवन आप कोई नहीं पूछना चाहिए।
Chale, ठीक है. If you have any question, you can send me also. I'll give you the mobile number. And if you have any project also, we can go for it. Yeah. So anybody wanted to do a research. I went to a place called Chamba. I also said to undergraduate student. So one of the girl had written a project and she was making a presentation. I just told her, are you a PG student? And she said, no sir, I am a second year medical student. You can do it. So if you write a protocol, you say, okay, go to one template, split 2012. Go to one website, Equator. So once you go to Equator, you get to know that how you conduct all the studies, all the guidelines are there. You write a paper, so we have a guideline. So this is how we can progress. If you do it, your junior and said that, he has done it, we can also do it. Okay? So I think they're calling me. So we'll take a photo from this side.
Sir, you
Yeah.
तेरे बच्चे बहुत इंटेलिजेंट है सर, क्रिकेट में बहुत अच्छे
ईश्वर अपने साथ है, डरने की क्या बात है। ईश्वर अपने साथ है, डरने की क्या बात है। सदा सफलता साथ हमारे, सदा सफलता साथ हमारे, हाथ में उसके हाथ है। ईश्वर अपने साथ है, डरने की क्या बात है। सदा सफलता साथ हमारे, सदा सफलता साथ हमारे, हाथ में उसके हाथ है। ईश्वर अपने साथ है, डरने की।
हाँ, एक काम तो रोज कर लो, एक तो फोटो ले लीजिए।
हाँ।
तो सर ऐसे ले लीजिए सर।
हाँ ऐसे ही ले लेते
पीछे आके प्लीज दो जरा
कोई
प्लीज।
कोई एक
सर
जना।
के मोबाइल से आपने भी फोन से जल्दी आप मोबाइल से फोन ली।
हाँ।
जल्दी हम पास जाओ।
Can you take a photo
हाँ, तो
from this?
अच्छा लगेगा जल्दी हम।
हाँ he has come.
ठीक है सर।
आप भी आ जाइए एक फोटो। आप आ जाइए
सर
इधर।
बच्चों को खड़ा करने के लिए
हाँ we can stand.
सर सब सर के साथ आ जाओ सर।
हाँ जी।
इधर आ जाओ सर के इधर लाइन से बता रहे हैं पीछे नहीं होगा। सर के साथ जो एक अच्छी यादें हैं। फिर आप भी आ जाना बाकी सारे बच्चे नर्सिंग के बच्चे आ जाओ आगे आ जाओ आराम से कर रहे हैं।
ठीक है।
फिर ये ना बहुत चंचल है दिल का बहुत अच्छा है पढ़ने में थोड़ा ये
थैंक यू एवरीवन।
फोन से भी खींच लो ना
हाँ
फटाफट जल्दी करो फिर ग्रुप
हाँ।
में डाल दे सबको दे दो फिर जल्दी करो फटाफट पास आ जाओ नर्सिंग के बच्चे भी सब आ जाओ एक अच्छी यादें रहेंगी पीछे वाले बच्चे आ जाओ।
थैंक यू मैम।
सब एक बार सर के लिए दिल से ताली बजाओ।
हाँ थैंक यू वेरी मच। ठीक है जब मिलता हूँ।
आप जिस व्यक्ति तक पहुंचने का प्रयास कर रही हैं, वो इस समय आपकी कॉल नहीं ले पा रहा है। कृपया बाद में फिर से प्रयास करें। The person you are calling is not answering.
ये जैसे ना
Try later.
नहीं